Vaginal atrophy is more than just lubrication. And if you feel burning down there, like at any time, I'm about to tell you why. Hi, I am your local OBGYN. I love women and let's talk about it. So, when you have an atrophic vagina, basically it means that there is thinning and loss of estrogen as a result of perimenopause and menopause. Duh, we know this. But I just had somebody recently come in, and what they had expressed was that they felt like their insides were uncomfortable, even if they sat for too long. And they were actually using a hemorrhoid pillow because they had too much discomfort when they were out and about. And it was kind of embarrassing to have to bring a hemorrhoid pillow wherever she went. But she's a tiny lady, and when she sits, she gets more pulling and tugging on the tissue. She's not sexually active anymore because that is just like an undoable scenario. So what we sort of talked about was, does she feel burning on the inside? So she's been given estradiol cream, which is supposed to re-moisturize the tissue. She's not quite using it the way that she's supposed to. She's actually underutilizing it. And one of the things that we talked about was she could be adding moisture back, but if she's underutilizing the cream, she may not be adding stretch back. Compliance is the ability for tissue to sort of have that like stretchiness, and that stretchiness gets lost, so that when you do things like put a little bit of tension on the tissue or try to have intercourse, you're actually like tugging on incredibly dry skin and causing all these little like micro tears in the vaginal wall, which you're not necessarily going to see like blood because it's like a cut, but it's like little micro perforations in the skin that will feel like burning if you do it. So that is exactly what she was describing, and she's going to up her estrogen game in the vagina, and hopefully, fingers crossed, we get some of that stretch back.